Welcome. In this video I'm going to talk to you about baseline risk and effect on treatment decisions. Here's a headline in a newspaper about taking HRT pills to cope with the menopause, and the headline is, "It doubles your risk of suffering dangerous blood clots." This work is based on this study published in the BMJ. It's open access, just here you can see, and it's the use of hormone replacement therapy and risk of venous thromboembolism, and it's a nested case control study. I'm going to talk to you about this paper and how you might interpret the results based on relative measures and absolute measures. Here's what the researchers stressed, that although the risk of blood clots doubles for women who take HRT tablets, the absolute risk remains small. Let's try and explain that. What do we mean by remains small? Let's take this first trial in high-risk patients. Here's the trial. It's a new drug for heart attack, and here you can see there's 40% mortality in the untreated group at 30 days, and here in the treated group the mortality is 30%. The question is, how would you describe the effect of this intervention? Now, let's think about that. There are two ways to do this. The first is to take the difference, the risk difference. 40% minus 30% equals 10% difference. There is a second way, though, to express this measure, and that's called the relative risk reduction. That's the relative decrease in the risk of an adverse event in the intervention group compared to the control group. That's 10% of 40% equals a 25% relative risk reduction. Now, here's trial 2. Trial 2 is done in low-risk patients. Same drug, same effect to reduce mortality, but there's a 10% mortality at 30 days among the untreated compared to 7.5% mortality among the treated. Again, how would you describe the effect of this new intervention? Well, just like last time, you could take the risk difference. And here you can see the risk difference is 10% minus 7.5% equals 2.5%. So a much smaller difference between the two interventions. But if you were to calculate the relative risk reduction, what you'd see is that 2.5% expressed as a 10% here is now 25%. So you've ended up in this situation where you have two interventions, very different groups, but the same relative risk reduction. 25% here, 25%. But risk differences are much different. 10% here, 2.5%. So if you refer back to the news headlines, doubles the risk of suffering dangerous blood clots. That's very hard to interpret. What does that actually mean? But if we use the methods that we've just done and gone into the actual study, looked at the BMJ paper, we find the actual results. So the risk of deep vein thrombosis without HRT is 16 per 10,000 or 0.16%. With HRT, the risk is 25 per 10,000 or 0.25%. And in fact, if you go into the back of the paper, into the discussion, the researchers express this result. For every 10,000 women who take HRT pills, there are just 9 extra cases of clots every year they found. So, what are the summary points about relative risk reductions and risk difference? Relative measures are often more impressive than absolute risk reductions. The lower the risk in the control group, the larger the difference between relative risk reduction and absolute risk reduction. Therefore, when you want to come to treatment decisions and you're faced with the news headlines, try and find out what's your baseline risk, what's the absolute difference between the intervention and treatment group to inform whether you should take the treatment or not. Thank you very much for listening.